Well, good afternoon, everyone. We are on to our final case study for the season. This is welcome to case study 5. My name is Roxanne Whittingham, and today we're discussing the case of Melissa. Melissa is a 14-year-old girl who's been struggling with anxiety since the beginning of high school last fall. So I just want to paint the full picture of what we were working with here today. So Melissa's story begins with what seemed like, a typical transition to high school, but it quickly became something much more challenging. The summer before ninth grade. So obviously, while she was in eighth grade, she started experiencing some panic attacks. By the time school actually started, these attacks were happening almost daily. Now, what makes this particularly concerning is that she managed to hide the severity of her symptoms from her parents for months, and I think that's very hard to do, but it shows some amount of strength, right? So it wasn't until she reached out to her school's guidance counselor that her parents even became aware of how serious things had become. When her parents learned about her struggle, they were shocked, and as we can imagine. And this shock makes sense when we understand Melissa's reasoning. Um, so she deliberately kept her anxiety hidden because her parents had recently divorced and she didn't want to burden them further. And I totally get that. From the point of view, I can reflect on my teenage days. I really didn't want to bother my parents with something, so I kind of dealt with it on my own. So to continue on the case, in her words, she said they had enough on their plate. This shows remarkable empathy for a 14-year-old at that age, for her to be thinking like that. And it also reveals a concerning pattern of prioritizing others' well-being over her own needs. So I want us to focus on that a little bit. Now let's talk about why age 14 is such a critical developmental period. Based on what we've been learning in our class, in our course. So, particularly when it comes to vulnerability to anxiety disorders, we want to look at that. At this age, Melissa's brain is undergoing significant changes that directly impact her ability to manage stress and also to manage her emotions. As we learned, the prefrontal cortex, which is responsible for executive functioning, decision making and emotional regulation. They won't be fully developed until around her mid 20s. Meanwhile, her amygdala, the brain's alarm system, right? That's part of the brain that's supposed to alert her. This is highly reactive at this time during adolescence. Now, this means her brain is essentially primed to perceive threats more intensely while having fewer fully developed tools to manage those preconceptions, right? So the transition from elementary to high school, this stage represents one of the most significant changes in an adolescent's life. And, this is very personal to me because I have to deal with this like very regularly, year in, year out. As a graduation coach, this is something that I deal with, right? Because I also do grade 8 transitions to help students function better in high school. So this is really, really personal to me. Now, what we want to do, we want to think about what Melissa left behind, right? She's leaving behind familiar teachers who knew her for years. She's also living behind a smaller building. Than this building she could navigate with her eyes closed, right? She knew the surroundings. Elementary school is always like smaller, more secure than high school. And then she's also living the social status of being one of the older students. So now in elementary school in grade 8, you are the older person, right? And now all of a sudden you get to high school and you fall right at the bottom. You are now the youngest. So the expectations are higher and the social dynamics are like infinitely more complex, right? There's so much to deal with. She's gone from having one teacher, as we know, for those of us who did, elementary school, even for me that did my elementary school in Jamaica, I know how that is. You have one teacher, we used to call it a form teacher, and that teacher knew her very well. And now she's having 6 or 7 teachers who are still learning her name. So just think about all those pieces. So many times that, when my students come to my office for a session and I would ask them, so which class are you coming from? What's your teacher's name? They can't tell me. I don't remember the teacher's name, right? So just think about that for a minute. Now, the academic demands have obviously increased substantially from elementary school to high school. There's more homework, more personal responsibility, and that constant reminder that this now counts for college. So you have like a free for all in elementary school. You're free, you're young, living young and free. And now we're thinking, oh my God, whatever I do here is gonna count towards whether or not I go to college or university. All right. So that's what she's facing. Now, socially, 14 is an age where peer relationships become increasingly important while simultaneously becoming more and more complicated, as I'm saying here. The fear of judgment is at an all-time high, right? That's one of the huge things. How are they going to see me? Am I going to be cool, one of the cool kids? Am I going to be one of the popular kids? And I'm just repeating some of those things that I hear my own students having to deal with at school. You have social hierarchies, right? And social hierarchies now are more pronounced in high school. And finding, you're going to have to be trying to find where you fit, where she fits in. And this can feel very overwhelming. For someone already prone to anxiety, every social interaction can feel like a test you might fail. The lunchroom becomes a minefield of decisions: where to sit, who to talk to, how to avoid looking alone or out of place. You don't want to be singled out. This is also a crucial period of identity formation. So Melissa is trying to figure out who she is, separate from her parents. She, that parental umbrella is not going to be able to shelter her in high school right now. She don't even want her mom to know most times because that's not cool, as the kids would tell me. So while her family structure is fundamentally changing, she has to navigate all of that. So divorce is on the back burner, and now she's dealing with all of these complexities. Now, the typical adolescent question: who am I? Where do I belong? What's my future? All of these become even more complex when the family foundation feels unstable. Mom and dad separating, am I going to be living with this one, that one, visits here and there, right? Research by Kessler and colleagues in 2005 found that anxiety disorders often have their onset during adolescence, with a median or middle age of onset at around 11 years old. Now, this isn't coincidental. It is a perfect storm of what they call biological vulnerability, storm of cognitive development, allowing for more abstract worry and increased environmental stresses. Melissa's case here exemplifies all of these convergence of factors, right? Showing us why early intervention during this developmental window is so very crucial. Now, as I said before, as a graduation coach working with the elementary schools as a transition coach, and then also being in the high school system, this case really resonates with me. I see this every day while executing my role. And I'm excited actually, to see how we can support Melissa as an interdisciplinary team. And with that said, I'm just going to pass this over to Patricia to look at how do we understand the anxiety and the family dynamics when we're working with Melissa.
All
Thank you,
right,
guys.
Roxanne. Thank you so much for that. And my name is Patricia Toyo, and I want us to go through understanding the anxiety and the family dynamics. So, to be able to support Melissa, we need to know where she's coming from, why she's feeling the way she feels. And from what we can see, two major things are happening in her life together, and that can seem like a whirlwind for a teenager. Currently, she's having psychological anxiety of her parents living apart, and then she's having the psychological anxiety of okay having to move to a new level of her life. And Roxanne, you've already very well expounded all the changes that happen in a teenagers, especially when they have to shift. It's a major life shift for them, moving from
Right.
elementary school to high school.
So,
For
mm-hmm.
me, not having been in this system for a while, it's very enlightening to know that, because for us back home, it's usually a
Mm-hmm.
one-way street. So you can be in the same school from nursery till you're out of high school, and then you go to college. So I can
Okay.
imagine. So you probably grew up together with all your classmates. So you
Mm-hmm.
can now imagine what that feels like for a child who has to move from one phase to another. And it can be a plus, but for her, she's not able to like overcome it easily.
Mentally
That
process
is
that.
because something else is also happening in her life. And it's easy for her to have eaten it from her parent because they are living apart. They also are going through stuff from the breakup that is probably clouding their attention and not helping them to, look intently at Melissa's case as they would. Now, so, as a 14 years old, she's in early adolescence, and this is a stage characterized by significant emotional, social, and cognitive changes, like you've already mentioned. And they also experience increased sensitivity to social evaluation, academic pressure, and stronger desire for independence. Unfortunately for her, this independence is coming at a time where her parents are breaking up, so that is probably shaking her. This should be a time where she's looking towards being independent, but she may be feeling some form of abandonment from our parents, breakup. And transitions such as moving from elementary to high school can highlight these pressures more, because now, like you said, they're going to a larger environment, new peer groups that she has to navigate. And trust me, high school drama is not for the faint-hearted. So,
Oh no.
yeah. So she might be going through what is anticipatory anxiety, where someone worries about a future to the point that their body responds with intense fear and panic even before that happens. And so panic attacks are intense episodes often accompanied with fear and have physical symptoms such as rapid heartbeat, sweating, difficulty in breathing, and a sense of losing control. It can sometimes mimic asthma attack in patients who don't already have it. When these occur frequently, they begin to associate it with certain environments, such as the thought of school, the thought of going to a parent's house, a second parent's house for the weekend, and all that. It heightens those situations and can lead to potential avoidance behavior. Another thing about this and how it can impact Melissa is a tendency to internalize her distress. She's the type of person to look out for others. Oh, I don't want mommy to worry. She's going through a lot. I don't want daddy to worry. He probably doesn't care. So she feels like I can do this by myself. And that also reiterates the point of independence, where she feels like I'm a big girl now. I can do this. She is intentionally avoiding telling her parents her struggles because she doesn't want to stress them. Adolescents also sometimes feel responsible for maintaining family stability. Sometimes children whose parents go through divorce kind of accept a blame, feel like they're the ones, like maybe because I don't do well in school. That may be the reason why. Maybe
Yeah,
because my extracurricular activities are so expensive. Maybe that's why my parents fight about money all the time. So as a result,
that's
they
true.
kind of repress their own emotions their needs. And this type of suppression can worsen anxiety for someone like Melissa, and especially when she lacks the supportive outlet to process this feeling, and the emotional maturity to also, process them. Without open communication, this anxiety may grow until it manifests into more intense things. And we have seen, for this case, panic attack, and it could get worse. Because if it's not taken care or nip in the bud right now, it could go into substance use disorder where she's trying to find a means of escapism or coping. Now, it is great that she has sought social guidance from a school counselor. This demonstrates insight and self awareness. So, as much as she's going through a lot, and it also still demonstrates that independence that we're talking about. And it's a protective factor that she feels safe enough, you know, from a school, in this particular school
Mhm.
environment, to seek help.
Yes.
So, the impact on family changes, I will just go through that very rapidly. Is Melissa's parents going through divorce is a significant family disruption. And even though parents sometimes, while going through divorce, try their best to shield their children from the conflict, adolescents are mini adults. They know what is happening, they are aware. And this is one of the reasons why she's like, oh, they have enough on their plates. And this dynamic
Right.
can also change the parent child role, where the adolescent feels like, I have to protect my parent emotionally, where in their mind,
Mhm.
they feel responsible for protecting their parent. And that can lead to a lot of pressure that she already has. Now, despite these challenges, our parents appear to be supportive. And once they became aware of the situation, they also want to know how to help her together. So they went together. That is a strong protective factor. Even though they are divided in their emotional, relationship with one another, they are united in their attempt to support their child. That's good. Positive family
That's good. Yeah.
improvement can significantly improve outcome for adolescents who are experiencing anxiety, especially when the parents are educated on what anxiety disorders are, how to maintain open communication, shifting that role, that parent-child role back to what it should be, letting her know it's okay to come talk to us. We're not too busy. Even though we may not see eye to eye on our love relationship, you would always be our love. You would always have our support. We would always be united where it comes to you. Helping her know that will calm her down, and it will create an environment where she feels comfortable expressing her distress, which should, hopefully, with good emotional skills, cognitive behavioral therapy, help her to, mitigate panic attacks in the future. So I don't know if it's Shay, Timmy, or Lauren. I think Lauren that will take it over, helping us to know how to treat
Thank
her.
you.
Thank you.
Yeah.
Yeah, thank you, Patricia. I'm gonna discuss some of the treatment approaches and interventions from a couple different lenses. So I think firstly, from a cognitive behavioral perspective, therapy could help Melissa identify some of her negative or fearful thoughts that would be contributing to her panic attacks. For example, experiencing thoughts related to having like a fear of failure, fear of embarrassment, or any worries about fitting into her new school. Cognitive behavioral therapy would help her recognize these patterns of thinking and learn how to challenge and replace them with more balanced and realistic thoughts. Melissa could also learn practical coping skills to manage the physical symptoms of her panic attacks, like deep breathing, some grounding techniques and relaxation exercises. And over time, I think gradual exposure to anxiety provoking situations at school would help her build the confidence that she would need and reduce avoidance behaviors. From a family perspective, I would focus on how family relationships and communication patterns influence Melissa's emotional well being, like Patricia and Roxanne mentioned previously. Um, Family therapy sessions could create a space where Melissa feels comfortable expressing how the divorce and other changes might have affected her emotionally. And I think this process could also help her parents understand that Melissa has been trying to protect them from additional stress by keeping her struggles to herself, but at the end of the day, it's only making her struggles increase. So I think that would be a big thing to tackle in a family therapy session. And through these conversations, the parents reassure Melissa that she doesn't need to hide her emotions and that her well-being is important to them. Parents could also learn ways to respond calmly and supportively when Melissa does experience these anxiety or panic attacks. Um, Developmentally and emotional support is also a great factor. So, from a developmental perspective, providing Melissa with some psychoeducation about anxiety and panic attacks could help normalize her experience, and learning about how anxiety just affects the body and the mind in general may reduce any like fear or confusion about some of the symptoms that she is experiencing. Melissa could also benefit from learning emotional regulation strategies, um, maybe journaling or like mindfulness exercises, encouraging healthy coping strategies like maybe physical activity or finding a hobby. And over time, definitely developing social connections can help improve her well being as well. And lastly, I'm just going to briefly talk about some school based support just because I know some of the treatments and interventions might be a little similar to Satemi's like support system in long-term planning. So I just want to be able to make sure that we all have a chance to share some ideas. So since Melissa's anxiety is closely connected to school, I think involving school staff would be an important part of her support plan. Like you guys previously mentioned, I think with the guidance counselor and how they can just continue providing regular check-ins where Melissa has a safe space to talk about how she's feeling, like she has previously. Teachers may also be able to provide small accommodations, maybe some flexibility with assignments during her stressful periods, given the circumstances, and having access to quiet spaces or maybe permission to step out briefly during moments that she is experiencing intense anxiety, I think would also help manage her panic attacks during the day. So I'll wrap it up there for now. So Temi, I'll pass it over to you to talk about the support systems and long-term planning.
Thank you very much, ladies, and thank you for your contribution. My name is Oluwafemi Temi, and I'll be speaking about how we can build support system and the long-term um, planning goal. In case of Melissa here, I have a few points in my study guide here. Like we understand that in Melissa's case, one very thing that is very important is to build a strong support system, and we understand that building this system, building this support, we cannot involve only the family. It has to be a collaborative involvement, like the school, the family, and even also, if possible, we can involve the mental health professionals. So one thing that is very important now is to strengthen the family communication. And because we see that Melissa avoiding to tell her parents about this anxiety, because why did she want to tell them? That was because she didn't want to burden them, because after that, like the parents are going through divorce, so there's like she doesn't want to like put more burden on them. Like she doesn't want to put her own anxiety and increase their parent anxiety also. So she was just thinking about her parents alone, and that's actually even made her not to be able to lessen her burden. And her parents can help her, by reassuring her that her feelings matter, because no matter if they are going through divorce, they still have to feel, they still have to make her feel like welcome because she is their daughter. So like her parents can help her by reassuring her that her feelings matter, and by creating a safe environment, where she feels comfortable sharing her emotions. Because firstly, we have to, as individuals, we have to have like a family, a safe place. Family should be a safe place whereby we can share, our ideas, our emotions, or whatever we are feeling uncomfortable with. And okay, secondly, talk about the school support. Like, having that she just changed school. So like school support plays a very key major role in Melissa's case. And since her anxiety began during the normal transition of high school, teenagers, high school, and I think some teenagers, you have they start puberty, start having emotions. So it can be a very tough thing on them. So in this case, we can incorporate the guidance counselor. We can get the guidance counselor of the school to provide support, for Melissa in this case. And there are things that they do for like students also, like accommodation, for example, like in tests or exams. They can actually, they can actually support her by giving her accommodation, like extra time in studying, in preparing for an exam, or maybe extra time in taking the test or an exam, so that this can actually make the reduce panic
Anxiety.
attacks. Maybe
Yeah,
reduce
yeah,
panic attacks. So people like her, everybody can have like 1 hour, but she to write a test, she can have like 1 hour 30 minutes, just because she has no this panic attack of changing schools. Not like she doesn't know the book, but if she's able to get more extra hours in preparing and writing the test, that can help
yeah.
her feel less
That's
panic attack.
anxious.
So
Yeah,
and
yeah,
this can make her know that this being the new school is like a safe place. So by that, she will not really feel overwhelmed if they are putting consideration into that for her. And I also want to talk about professional mental health support. Is very essential, because we talked about what is that, CBT, cognitive therapy, behavior therapy, right, in one of our courses. And this can help her, it can help Melissa to really understand what anxiety is, you know, how to navigate it, how to cope, and if she has no experience, she hasn't been taught how to, like she's a teenager, she's just high school, she's just moving school. So like breathing exercises, mindfulness, grounding techniques, and these are things that probably we all do in our day-to-day activities, but because we don't really know that they are linked into coping strategies for anxiety, we might not really see it as a big deal. But for her, if they are teaching her, they're making her know that these are things that she can do to help her cope with anxiety. It will be a very good benefit for her at the long run. So, like the long-term planning for Melissa should just gradually be for her to be able to gradually develop coping skills, that can help her manage her anxiety. And we should also notice that this coping skill should be something that she can do independently. We don't want to be like every time call her to the professional, but we should be able to teach her that independently you can cope with it. You can use these coping skills to handle the anxiety. So we have to like encourage healthy routines, like physical activity. We don't want you just to lock yourself up in the room, or just stay glued to the TV, or just stay glued to the phone or something. We need to like physical activity. What sports do you like? What do you like to engage in, like that? Even taking walks, vitamin D is very, very essential also, and on the long run too, we also want to have make her, like, encourage her to have supportive friendship, that can also help improve her emotional well-being. We don't want her to be associated with people that that brings her down or that belittles her. So we should try and
mhm,
encourage her to have a supportive friendship. And also, like I said initially, that family is a very important aspect of life. So if there's family therapy, we can also address family therapy may also help to address the emotional impact of the divorce and improve communication at home. Like some divorce shouldn't end in a messy note for everybody in the family. The parents once loved each other before, so it shouldn't be in a messy situation. So there should be like there should be a like um emotional arrangement, like emotional stability when the divorce is involved, so that it doesn't affect the growth of the children. So there should be there should like so it should, there should be improvements in communication at home, and so that Melissa will feel like very comfortable to share what she's going through, the anxiety she's going through, with her parents, without having to worry that, oh, I don't want to burden my parents because they are actually going through a divorce too. I don't want to bother them. So she should be able to feel comfortable sharing the anxiety with them. So overall, the goal is just to help Melissa, feel supported, develop confidence in managing anxiety, and also to build resilience, so that she can eventually succeed, both academically and emotionally. And this is a very good way to round up this case study, because it's very important for individuals to be at young age to be able to manage our anxiety, because definitely, even without like even grown-ups, without nothing, not thinking of anything. They will just come. I don't know if anybody else actually go through that. I can just be on my own and start panicking. You just start digging your brain out. So why my
Yeah.
heart beating so fast? What am I
Yes.
scared of? I have my family, I have everybody loved one, but you're just scared of something might happen. But if they've brought us through like back home, and if they talk about anxiety, it'd be like I'm sorry, it's like a spiritual thing. Nobody really believes in it, but when we know
Mhm.
that, then we know that things like this happen. But if we are taught on the coping mechanism, on how to, like, cope when you feel
That's what
anxious or
I
when you have heart palpitations, what you can do, I think at the long run, everybody will be able to adjust to life emotionally.
said.
That's just
So
some of my
like
inputs.
some psychoeducation, you're making reference to Satemi, right?
Mm-hmm.
Just educating, and I think you hit some very good points, right? Just all around, like, and as you mentioned, like good friend groups, right? Because for example, like when I see things like this with some of my students, another thing I wanted to add there, Satemi, to your thing is like joining clubs, right? You have clubs in the school, so you have so many clubs that the new students can join. So that is where you had mentioned that the whole team has to be on board. And you hit another important point too when you talk about the parents themselves are going through divorce. So they too having, if they get some help to deal with what they are transitioning to, if they can help get some kind of counseling as well, and deal with their issue, then that can really put them in a better state that they
Mm-hmm.
can support Melissa, right? I
Yeah.
didn't really hear you say, and I think you mentioned too, like sports, maybe getting
Yeah.
involved in extracurricular. Did you say
Yes, I
something?
mentioned that something that
Yeah.
that she likes to,
Yeah.
even sometimes we don't even know that we like something until we involve
Yeah.
ourselves in it. So that's just
Yeah.
it. She might not like she like basketball or swimming until you actually try it and you see that it actually
Yeah.
helps with anxiety. That's what I was
Mhm.
trying to say. Mm-hmm.
Yeah, yeah. Just exploring, like you said, some gifts, whether it's gonna be music or
Mm-hmm.
like they say physical activities here. We just say PE or
Yeah.
whatever, right? Yeah. Join some
Mm-hmm.
club, do something and kind of take your mind, meet some friends, right? And I think that's one of
Yeah.
the fastest way to make friends is to join a
Yeah.
club, right?
Yeah.
Because that really helps to reduce some of that anxiety. Like you feel like you have you have your own little group kind of thing. All of those are very, very, very
Yes.
important points there. So I think we have really touched a lot. Like Settlement said, the goal is to ensure that she feels safe. Parents can also establish some new routines, right? We know that when parents split, and I mean, I've had that experience where parents split, and sometimes you may be going to dad for this, you're going to mom for that. I mean, they could make it fun. Where this Sunday I may be going to dad for dinner, this day is movie night with mom. Something to the parents can do now that they recognized that there's an issue going on with their daughter. Just finding different ways to navigate it. Like it's the situation is already there. It's just how to navigate, and that education piece, that support from the points that Lauren mentioned with getting the professionals in, the points that Patricia put in, right, and certainly just having that all around wraparound supports, the guidance counselor, right. And I mean, this is something, like I said, like I see this in action every day, actually. So when I saw this, I was like, kind of just kind of excited to say, like,
Yeah.
how are we going to really support her? And there's a lot of help now, right? Because I know Satami mentioned something like, and I think Patricia too, like back in our country, when you look at this from a cultural lens,
Yeah. Cultural
we
sensitivity.
don't have this. Right, because you mentioned something very important, Patricia, that you could be in one school right throughout, and you know everybody, right? So you don't have to worry about now, you're gonna have new
New
friends.
friend
You could be with the
groups.
same
Yeah.
people. Yeah. So it's so different when we come, when, and I don't know, Lauren is probably not able to understand from where we're coming from, right? We don't have that transition very much in the Caribbean or in African countries. We just have like, one building or one area, you go from grade one all the way up. Everybody knows everybody. It's a small community or district or village or whatever we call it, right?
Yeah, and
But
can you imagine how
yeah.
beneficial that would be even here? Because I obviously grew up, I was in like elementary school from like JK to grade 8, and then I did high school from grade 9 to 12, and then
Yeah.
like university and college. But I feel like if students were able to stay in the same school, in the same area, the
Mhm.
same people from
Yes.
when they were little all the way up to end of high school, I think that that would prevent so many like
Yes.
problems
Panic
that like
attacks and
teens
all the
are facing.
atrocities. Yeah.
Yeah. The only reason why
Man,
a child will move through school will be probably maybe you moved areas, like you move from one state to
yes.
another, a town to another. Usually you'd
Or
stay in that
parish. We
school.
call it parish. Yeah.
Exactly. Or maybe your parents got into some money and they can now afford a better school, then you go to a private school. So those are the instances where you then have to move from one place to another.
Yeah, so it's a very interesting dynamic for us, even
Yeah.
as immigrants, to learn this. Like, I mean, it took me a while to learn the system here, the education system, right? But and when I saw that, I really see how it's kids get scared. Like, I mean, I was at school one day and there's a student came into high school, and a matter of fact, they came straight from an international country. So even thinking about that dynamic, came straight from another country straight into high school here in Canada. And that child was hiding in the bathroom all day. And it was a teacher that found them, brought them to my office. Obviously, it was a black student, right? And the minute the child saw a familiar face, and the minute I opened my mouth and spoke, and they realized we had similar background, they were Jamaican, that you could see like the
Really?
breathe,
The relief.
the just breathe, the relief. That's the word I'm looking for. You could see the relief, and I was able to, as a graduation coach, a part of my role now, I could call all the teachers and say, hey, you know what,
Yeah.
Patricia is gonna stay in my office for the rest of the day.
Day.
She's not in a good space. Can you tell me what assignment, what are you working on? And the teacher would say, okay, go on D2L, and this is what we're doing, this is the topic, and that child would stay in my office if they want to stay there for the whole week until. And then another thing I would do is I have a Black Student Association that I created. So when the kids come down for lunch, they always come to my office for lunch. One of the things I do, I introduce this new student to the group. I ask all of them, introduce yourself, make her feel welcome, and then I pair her with somebody that I can trust. So I find one student and I would say, Setame,
Mhm.
Lauren is new. She's from Jamaica. This is what is happening. And I'm not saying that in front of everybody. I say it privately. I wanted to make sure that she gets to her class safely. Don't leave her. Have lunch with her, that kind of thing. And before the week is out, that child has a friend. And it's so
Yeah.
amazing to see the transition. And so sometimes little things like that, you don't even see how important it is in a
Yeah.
child's life. But just looking at this case, it just really bring me back to, wow, this is really important work that we're doing
It
here as a team.
is. It is. It really is.
I have a personal experience with this moving of changing of schools. I remember back in my country when I was in we call it GSS 1 and 2, like I think
Yeah.
grade 10 and 11 here, I can't remember, I don't know. So I was in just 1 and 2, grade 11, 10 and 11 in particular school. So we had to move to another state. Do you know, I was crying because I had to cut my hair in that
Yes.
new school. I was crying because the new
That
school, they have
was
to cut their hair for
traumatizing.
that one
Why do
year.
you have to cut your hair in
I had to cut
senior
my
grade? It's so
I had to cut
terrible.
my hair. As in, I was crying. I remember very well. So that bring me back to like, like, oh my god, it was very, very, very annoying
Very
thing. But yeah,
when I
Yeah.
had to cut my hair, I was crying to my mom. I'm like, oh no, this is my crowning glory. My mom said, you grow another glory. You grow another crown. It was
yeah,
Oh my
traumatizing.
goodness.
yeah.
Yeah.
Yes. Yeah.
I was thankful for the teachers I had. I had friends that were encouraging. Because imagine having to cut my hair and having people that were like, "Why are you crying?" It
In
won't
my
have worked,
head,
right? But
they're like, "Are
I had
you
people that
okay?"
were encouraging me. That were like, "Oh, it's gonna grow back. Don't worry." And I already
Yeah.
had 1 year to cut the hair anyway. So, but now, funny enough, I cut my hair at any given time. I don't even care about the hair anymore. So it's just like that.
So
Was another
this is
topic
this is
anyway.
so this
Yeah.
is a very interesting case, and we could go on, but you know what? One thing we can summarize is that just having a full wraparound support this is not just a family situation or a school situation. This is like a community effort, and I'm really happy, you know, the way how we were able to bring in our own individual lens and share our own personal experiences, and to help us really look at, you know, coming up with good support for Melissa. So with that said, I'm gonna say let's end it here. This is the end of case 5. I think we don't have
Yeah.
another case for right now. I really want to take this opportunity to say it was a sincere pleasure working with all of you from case 1
Same
through the
here.
case 5. I learned so much from every one of you, right? Lauren, who has, you know, like the Canadian lens, and we bringing our international lens here, and really working together as a team. And I'm really proud of everybody, and I really
Thank
thank you
you so
guys for
much.
coming up with me on this journey. Thank you so much.
Yeah,
Thank
thank you
you.
Thank
guys.
you, ladies, for your contribution.
I always learn lots from you three, so I'm glad that we were able to do the case study together over the last few weeks for sure.
Yeah, same here. Thank you so much, ladies.
Thank
All
you
right,
so
thank
much,
you so
guys.
much, ladies. Have a good evening.
Yeah, bye for now.
We'll meet shortly for our next case. So when we hang up, can we just come back on? Thank you so much.
Yeah, bye for now.
Bye. Bye for now.
Bye.